Amyotrophic lateral sclerosis, sometimes known as Lou Gehrig's disease, is an invariably fatal neurological disease that attacks nerve cells responsible for controlling voluntary muscles. ALS belongs to a group of disorders known as motor neuron diseases, which are characterized by the gradual degeneration and death of motor neurons. In ALS, both upper and lower motor neurons degenerate and die, and can no longer send messages to muscles. The muscles weaken and waste away and twitch due to the inability to function. Because of this disease, the brain can no longer start or control voluntary movement. Symptoms usually begin in the arms and legs and hands and swallowing muscles. This is John's story about ALS. As a young kid, John enjoyed playing baseball and football. He was a happy and healthy kid. He stayed healthy by participating in sports throughout high school and continued to play baseball in college. In college, John earned a degree in teaching for high school students. He raised a family with his wife, Jane. Everything was good for John until he began to feel off. John started to notice that movements that seemed to be natural became uncomfortable and less fluent. Some seemed to discomfort. John went to his doctor, where they told him that he may have a disease known as ALS. John went home that day and looked up information on ALS and found out that the disease is a rapidly progressive disease and that it was invariably fatal. Obviously upset, John talked it over with his wife and decided that they should find a doctor who specialized with the disease to confirm if he had ALS. When John arrived to his doctor's appointment, they performed multiple tests. The doctor told John that ALS is difficult to diagnose and that he would have to perform a clinical examination and a series of diagnostic tests to rule out other diseases that mimic ALS. The doctor then performed an EMG, an NCV, an MRI, a myelogram of a cervical spine, and a spinal tap. An EMG is used to test electrical activity of a muscle. An NCV tests how quickly electrical impulses move along a nerve. The MRI is used to rule out other diseases that mimic ALS. A myelogram is an X-ray that allows for detection of a lesion in a selected area of the spinal cord. A spinal tap is done to detect diseases that cause symptoms. The doctor also does a thorough neurological examination and a muscle and/or nerve biopsy to detect ALS. The doctor gave John his diagnosis and had confirmed that it was ALS. He apologized to John because at the moment there is no cure for ALS. However, progression can be slowed by medication approved by the Food and Drug Administration. The doctor also told John that most ALS patients live up to 3 to 5 years after being diagnosed with the disease, and along with the disease can come a battle. The doctor told John that the muscles in his body would start to weaken and atrophy. He will begin to lose strength to move his arms and legs and to hold his body upright. He will begin to have trouble with breathing and will eventually have to use a ventilator. His mind and personality will become impaired and he will have cognitive function, word fluency, decision-making, and memory problems. The doctor continued to explain the medical costs. He explained that the total expenses could cost around $61,000 per year. Once again, the doctor apologized to John because other than having the gene inherited by family, the cause of the disease is unknown. Here are some interesting facts. There are 15 new ALS cases diagnosed each day. It is estimated that 1 to 7 of every 100,000 people will have ALS. Study shows that ALS is probably not a single disease, but a combination of several related diseases with similar outcomes. The disease never impairs a patient's ability to see, taste, hear, recognize touch, or the ability to think or reason. Mutations in about a dozen genes have been found to cause familial ALS. How about some interesting statistics with this guy? About 10% of individuals with ALS survive for 10 years or more. The disease is most common among people over age 60, and the disease has no social, ethnic, social-economic boundaries. 50 of affected patients live at least 3 or more years after diagnosis, and 20% live up to 5 years or more. ALS is responsible for as many as 5 of every 100,000 deaths in people ages 20 and over.